Hello viewers, good morning on the occasion of World Hypertension Day. As you know, every year 17th May is celebrated as World Hypertension Day. This year also it will be celebrated, and this year's theme is controlling hypertension together. Check your blood pressure regularly, defeat the silent killer. Now, how can you do that? You can do that once you know the magnitude of hypertension in the society. 1.4 billion people globally suffers from hypertension, and in our country 35% of the individuals have hypertension in together. But in metro cities, the incidence is quite high. It is more than 50%, and this mainly happens because of the lifestyle, prolonged duty hours, lack of proper sleep, and chronic stress in daily life in major cities. And not only that, 1 in 4 individuals with hypertension, the blood pressure is controlled properly. 75% of the patients or the individuals who know that they have hypertension, either they're not treated or they're treated improperly, or they leave the hypertension treatment in between. So we have to really take care of that. Now, how can you do that? We can do by routine screening. So check your blood pressure, know your number. One of the best ways to know your blood pressure number in your every birthday, so that you know that what is your blood pressure, and then take a collective action. Once you know that the blood pressure is elevated, then the government, the healthcare provider, and the individual or the person who has high blood pressure should act together and then try to control the blood pressure. Now, if you control your blood pressure to a target range, then you can prevent stroke, heart attack, heart failure, kidney failure, peripheral vascular disease, dementia, and host of other diseases. So how can you know that you have high blood pressure? You have to know the normal figure of blood pressure is less than 120 by 70, and the blood pressure between 120 to 139 and 80 to 89 is elevated blood pressure. And hypertension is defined as blood pressure of 140 by 90 millimeter of mercury. Once you have 140 by 90 millimeter of mercury blood pressure, you are termed as having high blood pressure. Blood pressure is treated by three things: diet, exercise, and some medications. And diet and exercise are together called lifestyle changes. What should be the lifestyle? Lifestyle should be very active. You should go for a fitness regimen and attain the correct body mass index. And then if you are having habit of smoking or excessive drinking, you should give up. Smoking should be stopped immediately, and moderation in alcohol drinking is mandatory. Then diet should be 5 meals a day, 3 major meals, 2 snacks, adequate calorie, lot of green leafy vegetables. World Health Organization recommends 600 grams of vegetables per head per day. Salt should be minimum 5 gram salt per head per day. Oil should be minimum 30 ml per head per day. And then brisk walk or jogging or cycling or swimming should be regularly practiced at least 5 days a week. And then should do stretching and balancing exercises, and then exercise of the mind. Exercise of the mind is very important. It controls the blood pressure, and there is enough evidence. Now, once you have controlled the blood pressure, you should look into the target. Normal target of blood pressure is 120 to 129, and lower blood pressure target is less than 85. Once you have attained that blood pressure target, one has to continue the blood pressure medications regularly, because continued treatment leads to the reduction in the events. Once you stop the blood pressure medication, blood pressure will re-rise and it may produce a vascular event. So one should be very careful. In nutshell, if you change your lifestyle and attain a normal blood pressure with either lifestyle changes or medications, then you can prevent heart attack, brain attack, kidney attack in the society. So it's a preventive approach. I think you will agree with me that We don't want to have a vascular event and remain crippled or paralyzed. Thank you very much for your kind attention.